Hey, it says I'm alive, or it says I'm live. It's always nice to confirm from a computer that I am alive. I never know if I am or not. So, hi everyone, and welcome once again to the Wednesday night webinar brought to you by NOCD, an online platform for the treatment of OCD and related conditions. You can check us out at nocd.com. That's NOCD.com. And if you're looking for help for BFRBs like hair pulling or skin picking or tics or OCD or hoarding, we got you covered. So we work in all 50 states as well as in the UK and Canada and Australia. And we do take insurance here in the US. So check us out at nocd.com. Wait, there's someone else here tonight. Who the heck are you? And how did you get in here? What is going on? I don't understand. And you stole one of my No CD t-shirts, it looks like also. I
I
don't
did.
understand. Mackenzie, how are you? What's up?
I'm good. I'm excited that the live stream gave you reassurance that let you know you're alive.
That I'm alive. Yes. I didn't know if I was still here or not, but now I know. So that's good. Yeah. Cheers to the live stream there. Yeah. Mackenzie, fill everybody in. What do you do here?
So I am a support group facilitator, which I absolutely love. I also have OCD. Yay. Yay.
Well, tell it to go away.
If only. If
Yeah, all
only.
right. I thought I would give that a go. See if that works. Yeah, sometimes it does. Sometimes it doesn't. So.
Dang it.
Yeah. Mm-hmm.
Yeah, but I'm so excited to be here, and I love being able to make other people feel less alone and more understood. So happy to do it.
All right. Well, we got a line of questions. They start coming in at Bruce got his in at 127 today, so that's the first one. Bruce says, saw online that some people with OCD also suffer from maladaptive daydreaming. Can you tell us what you know about that and how to treat it? I will tell you, I don't know much about that, honestly. And how to treat it, not sure. But here's what I can tell you. Maybe it is maladaptive daydreaming. Maybe it is a distraction technique that you're using to not think about intrusive thoughts or images or urges that you're experiencing. I would think of it potentially as a safety behavior. And what I would want to do is maybe make something like a loop tape that would have your obsessions on it and have them just kind of playing. And maybe not even constantly, but maybe once every minute or so, it throws out one of your obsessions at you so that it brings you back to focusing on that and doing ERP around that instead of what you might be doing, which is going into this, as you call it, maladaptive daydreaming, which is potentially a way to distract yourself from the obsessions because you don't want to deal with them. That would be my thought, but I don't know. Mackenzie, has that ever applied to you? Do you feel anything like that in your own life? Or
Yeah, well, I think, I guess I can kind of pivot a little, getting stuck in your head and ruminating, I guess could be, kind of like daydreaming in a way esque. But I think when that happens, I just try really hard to pull myself back to the present and focus on what I was doing before OCD came in, and try to, navigate through it that way.
All right. Bruce says he also suffers compulsions without obsessions and vice versa. For example, intrusive thoughts with no actions, or for example, repeating actions without any intrusive thoughts. Please explain more about this variation, how to treat it. I don't necessarily believe that, Bruce. Let me tell you why. In 25 years of treating OCD, I haven't met somebody who didn't have both, even though the DSM says that. Alec Pollard, who was my supervisor, would to this day say there's no such thing. It's like a unicorn. They don't really exist, but they fart Skittles, which is awesome. And who doesn't love a good Skittle fart when they have one? But Bruce, I'm betting that there are things probably right now that maybe the obsessions are so automatic or the compulsions are so automatic that you don't even potentially notice that they're there. But I don't think they don't exist. That would be my throw on it. But Mackenzie, any thoughts on that?
Yeah, well, I kind of have like a question off it, so maybe you can
Mm-hmm.
clarify it for me.
Sure.
So, we obsessions, like the intrusive thoughts, are usually connected to a core fear that like
Mm-hmm.
fuels them. But a lot of times I do have that, obsessive behavior where, like, say I pick going into a drive-through line instead of going inside. And I'll catch myself, "Oh, I should have just gone inside. I should have just gone inside." And so there is an obsession there, right? Like,
Mm-hmm.
trying to find the certainty of, should I have gone in, or should I have, and I think, is that kind of what that would be? Like, you don't even notice that that's the obsession.
Maybe, or I think also we could have a trigger, and if the trigger comes, we just go right to the compulsion. I don't even know if we would need to have the actual obsession anymore, because we've had it so much that is it even necessary? So,
Yeah.
if the trigger, let's say, oh, what do I want to pick? Let's say the trigger is a door handle, just for ease of the thing that people would talk about the most, right? Do I need to have the obsession about what's on the door handle? Or if I've even gotten near the door handle with my hand, might I just go and wash it automatically in the off chance that I might have touched it and there might be something on it? Might I just jump to the compulsion? Well, yeah, right. Not the obsession isn't there. I think it's just so understood now as part of the trigger that you don't have to have the actual obsession appearing every single time anymore. It's just so automatic. And it's like, hand near door handle equals washing hand, so don't get sick, right?
Yeah.
Something like that.
Yeah. I think, before I got into exposure response, compulsions were kind of second nature. Even if I didn't know why, it was just part of my routine, and I think OCD tries to get you stuck too, and trying to figure out what the trigger is. So I always go back to, like, if it walks like a duck, quacks like a duck, it's probably a duck.
Yeah. And you raise ducks, so that's really cool on the farm that you live on there in rural
Yes.
Appalachia. Yeah.
I don't have ducks. That would be really cool though.
Yeah, well, you're not denying the living on a farm in rural Appalachia, though, I noticed. So that's
Maybe not.
maybe not. There we go. Yeah. Mary says, as for somebody who has relationship OCD, how can one go about deciding to get engaged and to marry a partner, regardless of the intrusive thoughts and feelings about marrying the partner? These have led to a fear of marriage. It's strange because I want to marry him and I think we're pretty great when I'm not anxious and in my head about things. It's moments where I feel clear, and then maybe other times when you're less clear. Mackenzie, you got married with OCD. How was that?
I did. Well, before exposure response, it was a bit of a dumpster fire. But I think that it's first of all, the cool thing about it is there's someone else to hold you accountable when your OCD is present. I think it's kind of like another, it's like checks and balances almost, kind of. But what I'll say is, OCD wants us to live life based on fear, right? And so if getting married, if being a relationship is something you value, the really cool thing about, doing exposure response and getting into all of that is being able to live that life that's driven by value versus fear. I think a really cool thing for me too was, if it's something that people feel comfortable with, having your partner come and sit in a therapy session and getting used to and understanding more about OCD and how they can help. Because I think our loved ones sometimes, there's this, it's counterintuitive. What they think helps with, like, reassurance, it's the exact opposite. And so it used to be really cool, not in the moment, but my husband would come into a therapy session and my therapist would say, "Oh, how's everything going?" And I'd be like, "Great." And he was like, "Really? Is it really great?" Because you're like this unreliable narrator sometimes. And so, he got to say, "Well, it's actually not great because we're not eating in the kitchen because we've decided the kitchen is contaminated and we're eating out and our finances are spiraling." Right. And so it was this somebody that was able to be a reliable narrator when I couldn't, I guess.
Yeah. That's interesting, in the sense that you probably, or your partner had to probably learn then how to walk a fine line, right? Of working with you, helping you, but not giving in to you, and challenging you, but not shaming you all the while in doing those things, right? It's got to be a tough experience. And uh, I think it's a potential good podcast maybe for a married couple to come and talk about some of these things. Mhm.
Yeah, no, I love that idea. And I think, you know, it's it's so misunderstood because of stigma. And I think it just allows, I think 99.9% of the time it's just people that are not educated on OCD and don't understand how to help. And it's not coming from like a bad place. And, I think there were so many times where my therapist was able to say, hey, like maybe that wasn't the best response. Mackenzie's really struggling. This is what we should say instead. Right. And then there were times where she said, Mackenzie, like you need to hold yourself accountable. These are the things you're working on. How can Montana, my husband, help you get through that? Right. It was a really cool experience because OCD can come in and create chaos so quickly, especially in a relationship or a marriage. And I very much so believe it's a family disorder. So I watched my husband kind of fall apart because I was trying to control, my OCD was trying to control everything. So him learning those tools in a way was really beneficial for both of us.
I would say, Mary, uh, OCD is not going to figure out your relationship for you and be the best decider of if it's the right relationship or the wrong relationship. Uh, I love the idea that you say that you think you're great when you're not in your head about things. I'm hoping that you're in therapy and working on this so that you can become more of that person over time and less of the person who is in your head and in the OCD. And I think that a great therapist could really assist you with that. And so that's probably what's most important for you to do. And remember, Mary, that if you don't get married to this person and you decide to live alone, then OCD will switch to other decisions you will make, like, is this the right car to buy, or should I live in this neighborhood or that neighborhood, or and it will always just go to something else. And then if you later on decide to date again, it will jump back into that and date. So let's all keep in mind OCD does one thing: it instills doubt in important things of your life. And if dating's important, it's going to be the doubt in there. And then if you give up on that and you decide just to be alone, it's going to go to other important decisions. It's not going to just walk away. It's just going to shift itself to other things until you recognize the pattern of it anywhere it goes. And you're able to say, oh, yeah, no, there, oh, you popped up there today. Oh, that's it. Okay. Well, yeah, I still see you. So whatever. And you move on. Right.
Yeah, for sure. I think it's, if you choose not to date, it's not okay, that's it, I'm gone, I'm not going to bother you anymore, like you won, that's all I wanted to take from you. It latches on to a million other things. So not only are you not dating or not getting married, now you're not doing that, and you're not doing all these other things that it's latched onto also.
Yeah. Tiny Dog says, when doing exposures, you sit and your therapist is with you, checking in every few minutes, asking where your anxiety level is. Other, they're pretty quiet. Is this the correct way? Should they speak through the exposures, reinforcing the thoughts? I think it depends on the kind of ERP that you're doing. There are some people that want to focus and concentrate. Their OCD tells them they must be 100% focused. I'm going to talk the entire time while they're doing something just to try to throw them off and show them that they can handle it. There's other people who don't like to have silence, because they feel their brain's running too much. In those situations, we'll have some silence. We'll be there in silence with it. So to me, it really is just going to depend on what kind of ERP we're doing and what for in terms of how we're going to run the ERP. I don't have one set way of doing it. It really does depend on the situation. Meg says, any tips for reading with OCD? You want to read, but your thoughts distract you, and then you feel like you're not taking anything in. Do you ever have that, Mackenzie?
Yeah, I do. And I also think that's a really good example of, like so many times people are like, I don't know if I'm avoiding, or distracting myself. And I think it's important to not put yourself in a box. And, I think asking your intention behind why you're doing something. So am I reading to get rid of anxiety, or am I reading because I enjoy it? But I think it's a slippery slope. But again, I try, if I value reading and that's something that's important to me, I really try to immerse myself in that. But if I'm, ruminating and stuck with OCD, then I try to sit with it and get through it before um, I read or watch a TV show. So I feel like that's kind of, I feel like if I was distracting myself with reading, then I would kind of be getting lost in my thoughts and not be taking things in, because the sole purpose wasn't reading. It was distraction or avoidance. Does that make sense?
Yeah. Meg, the other piece is OCD is always going to tell you you didn't get enough meaning out of it. That is the job of OCD, is to instill doubt and uncertainty into this experience. And so I'm wondering if you're disappointed about the fact that OCD does that. And your goal would be, how can I get OCD to stop doing that? And my answer is, OCD is not going to stop doing that. That's the job of OCD, is to instill that doubt and insecurity in you. That's what it does, hoping that you will do a compulsion. So, Meg, your job is to read and learn and do things. Maybe you won't get the full information. Maybe you won't quite get all of the meanings of it. Okay, well, we're gonna move on. Then we're gonna go on with our life, and if that's the case, OCD says no, 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 absolutely not, Meg. You must go back and make sure you get 100% answer on that. I will tell you, I got through grad school reading a lot of articles and a lot of chapters, and I can promise you, I probably didn't get 100% of the meaning of everything that everybody ever wrote, right? Even today, I read some things and I'm like, what the hell was that? I don't even know. Uh, I don't get everything. I don't get it right the first time. Sometimes it takes another time. And sometimes it just say, you know what? That that part is not as important as this other part, and I'm going to focus on this part because this is what I really need. And just being able to accept that that's okay. Hee Cowboy says, what's my experience in treating gender identity OCD, or TOCD, which you developed after sexual orientation OCD? You feel like you're alone and the only one going through the theme. And is this a popular new subtype? It's part of the sexual orientation subtype. It is not one that I've treated personally, but let's put that in caveat. I don't have a large caseload these days because, as the chief clinical officer, I got a lot of other things going on. So I have a very small caseload. So that's why I haven't treated it yet. If I had a broader caseload, I'm sure that I would get some. Do I consult on cases all the time? Yes. And I've consulted on cases like this. So it is not uncommon, and it is not the last new subtype. There, as new things come up, there will be new subtypes of OCD. We never talked about relationship OCD a decade ago, and now we do all of the time, right? Now it's seen as a big thing. So this TOCD, transgender OCD, identity OCD, yes, absolutely. As that becomes now more popular in the culture, OCD is going to grab onto that and say, what if it's that kind, right? And then I can't even predict what some of the future ones will be, but I promise you there will be more, right? So you are not alone in this one whatsoever.
Yeah, I think it's one of those things too, where I thought when I was diagnosed, I thought all I had was contamination OCD, and everyone always makes fun of me in my groups because I'm like, I actually have a fruit salad of themes. I've had them all. And I think I have like a love-hate with them because I understand their purpose, but then I feel like there's this misconception that you treat one theme differently than another, and at the end of the day, they're all treated the same way, right?
Mm-hmm. Yeah, we're going to do ERP. Absolutely. No matter what it is. And sometimes the new subtypes feel like, oh, but there's no treatment for this. Well, there is. It's called ERP, and it's worked for all the other ones. So we have no reason to believe it won't work for this one as well. Muggles are cool too. Someone's a Harry Potter fan.
I
Says,
love it.
Can you please go into some of the differences between quasi hallucinations versus stress induced vision changes? My short answer is no, I can't. And here's why: not a specialist in any of those things. And I'd have to go do some reading on that before I could even answer that question for you. So, no, I refuse to be one of those therapists who list themselves in a certain publication out there that lots of psychologists find themselves listed in, and other therapists, where they say that they specialize in 97 different things, because I think they're all liars when they do that. And it drives me crazy. So no, I don't specialize in lots of other things. I do work in anxiety disorders, OCD, trauma, hoarding, and I do ERP, and that's really what I do. So I am not the best person to answer this question for you, and I will not try to fake an answer for you when I don't really know. And I think that it would be disingenuous of me to even try to give you an answer right off the cuff when I'm just not sure. I'd have to do a bunch of research on that to be able to get you an answer.
That response right there is probably one of my favorite things about, you're just honest and to the point, and I think it's so helpful for people. Love it.
Yeah, I just, even my own family says, "What do you think about this?" I'm like, I don't know. It's not my area. I got to go read up on that. I'm just not too sure, right?
Unfortunately, you can't know everything.
No, and I don't even want to try to know everything.
No.
Right? I really don't. Darla says, you're the youngest of 8 siblings. You're the only one with OCD. Is it hereditary from like a parent, or is it environmental, or is it something you did in your past? The best answer that we have right now is it's a mix of environment and heredity is what it is. And so you may have a large predisposition toward something, but have no stressors in your life to lead to something to be kicked off. You may have a low predisposition toward something and have a massive stressor that could kick something off, and you can have the rest of it all kind of in the middle. So, but I'm intrigued in your third part. Is it something you did in your past? And Mackenzie, I don't know, maybe you felt this too. Like, was there ever a blame that you had, or maybe that your parents had about, oh my gosh, our poor daughter, it's our fault she got this, or anything? Did you ever have to deal with any of that for yourself or them?
I wouldn't say for myself. So my dad has OCD.
Okay.
And
Thank you, Dad. It's all your fault. Yeah. Okay. There we go. It's totally no. Yeah.
Mm-hmm. And my mom is probably watching this too. My stepdad also does. So I always tell my mom she has a type. But
she's got a type. Hey, Mrs. Mackenzie, mom, call afterwards. We can work on that if you need any help or anything.
No, but I definitely do. We're seeing a lot of signs in my oldest daughter, and okay. I definitely, for me, I get stuck in that genetic pool of oh, this is my fault. This is and I think, again, OCD tries to put me there too, right? In the what ifs, but for myself, I don't think my parents ever felt like it was something they did. Good. And I just, again, I think it's one of those things where we're never going to know for sure what caused it, whether it's environmental or genetic, or, maybe one day we'll be able to prick our finger and know for sure. But honestly, at this point, it doesn't matter, right?
I think we're 100 years away from that. I really do. Mm-hmm. Mm-hmm. So that's interesting with your daughter. How do you move yourself past that?
So I actually have a really hard time with it. And I also, so my youngest has autism. She's diagnosed with autism. And so something that, I try to talk to people about is we have to learn to manage OCD through the best of times and also the worst. And I think I got really stuck too with the autism diagnosis because my OCD years ago latched on to reading everything. And, if you had a stressful pregnancy, well, I was, knee deep in chaos in OCD when I was pregnant both times. And there was a lot of blame on myself there. And then, with my daughter, I think you know, it's I don't blame myself anymore. I think it's all about like accepting, you know, having that acceptance of this is, you know, the cards were dealt, and we have to navigate through them. I think it's the first time I've ever said I'm really grateful for my journey through OCD, because the really cool thing is I understand her brain, and I can, you know,
Mhm.
it's a little difficult to go from, you know, how do you talk about exposure response and take it to a 7-year-old level, which we call it the worry monster.
Mhm.
But you know, it's a really, again, trying to find purpose in the pain, I think, is something that I try to do with that.
Yeah. Awesome. Zoe says you have health OCD and you've been doing so much better thanks to ERP. You had a doctor's appointment today and did great. Also, got blood work done too. There is hope and treatment works. Well, thank you, Zoe. That is awesome. We're so happy for you. Congratulations. Yay. Golf clap. Golf clap. Very nice. Eric says, is it possible to get therapy from us if we're not in the US and your English is not perfectly fluent? Your channel makes me live again. Well, that's awesome. Yes, definitely. So check us out at nocd.com and we can work on that and see if we can get some people for you. So again, nocd.com, we got a care team available that can try to help you out. Caden says, I've been doing ERP with an OCD specialist for a couple of months. You were worried if you were gay. You've always been a straight male, and over the past couple of months, it's been a big fear of your mind. You've gotten to the point where you don't feel near the anxiety you used to, but the groinal responses you feel are unreal. I have never had groinal responses to men before, and they have been occurring like you're truly sexually aroused by them. You don't understand it. The anxiety has decreased, but the groinal response has increased to an extreme amount of intensity of what's happening. Oh, I know what's happening, but Mackenzie is a lived experience person. Do you want to throw it out there first? Go right ahead.
Well, I think, and correct me if I'm wrong, but
Mhm.
the sexual orientation OCD, it's not about necessarily the fear of being gay. It's the fear of not
Or
knowing,
straight, or
or,
bi,
or
or
yes,
trans, or anything. Yeah.
anything. Yeah, it's the
Mhm.
uncertainty around it and not knowing for sure
Yeah.
what you identify as. And I
So
think,
that's one part for sure. Mm-hmm.
yeah, the
Mm-hmm.
other thing I was going to say too is the groinal like responses, right? It's urges. Intrusive thoughts are not just thought; they can be
No.
images. They can be
Feelings,
images.
urges, tingling sensations,
Mhm.
whatever. I think the big piece on here, especially where a lot of people with OCD, and Mackenzie, maybe you've felt this too, that as you start to go through treatment and you start not to be so bothered by things, OCD says then, oh, look, you're not bothered by that anymore. That must mean you like that or you want that. Because if it was really, if you were really a person who didn't like this, you would be bothered by it. So how can you not be bothered by it anymore? Because you love it, because you want it. That's why. Oh yeah, look at that. And that's where OCD is just really an asshole, right? I mean, what a jerk of a disorder that it is, where there's you can never do anything right for OCD, right? You can't fear it too much because there's always more to fear. You can't not fear it because if you don't not fear it, it means that you want it. It just it is the classic no-win situation here in this world of obsessive compulsive disorder. So, Caden, I'm not shocked that the anxiety has decreased, but the groinals have increased, and you're wondering why maybe you're not so anxious about them. And it's going to lead you to wonder, oh, what does that mean? And then I want you to recognize this. All of this is a ploy for OCD to get you to go back and do compulsions. That's what it is. I can't be more clear than that.
Yeah, it's like it's a shapeshifter, right? And it's constantly changing and morphing, and you know, it's always trying to find ways to come back in and circle back. Like
Yeah.
we're never going to win, right? If we don't move through it and just sit with it.
Yeah. And, and you may feel it. Some people have trouble in the morning when they wake up. Some people are more maybe at night when they're tired. I like what you said, a tired mind can become a shapeshifter in some ways, right? I mean, you might get that kind of feeling. So Here's the thing, Caden. It's never going to feel right because OCD won't allow it to. But what it can do is it can get to a point where you can recognize that that's just the job of OCD, is to make that feeling happen. And then you can go, okay, and move on. And that's where we want you to go. But if you're going to spend so much time analyzing, what is this feeling? Am I feeling it right? Am I anxious enough? Am I not anxious enough? All of that is in service of obsessive compulsive disorder. Just know that that's the way that it goes. And it will always bring you down that path. Beth is here tonight. Hello, Beth. I like SB's question. Why does OCD suck and it's hard? You want to take that one there, Mackenzie?
Yeah, I mean, it does suck. It is, like Dr. McGrath said, it's an asshole. It really is. Like, it is, that is what it is. And I think that, it's because it's our own mind kind of weaponized against us. All the things we value, it makes it so real. There was something about driving OCD in that question, right, Dr. McGrath? Where did I say?
Yeah. Afraid I will hit someone walking, riding a bike, and then you U-turn. Haven't driven in almost 2 months. Been dealing with it since 2022. Also, is it true or false? Is there such a thing as just a OCD therapist? Yes or no? We do at NOCD specialize in OCD, and we are OCD therapists here. Yeah, so you can absolutely find a specialist in OCD. But back to the driving.
Yeah, that's one of the fruits in my salad.
Is that a fruit in your salad? Mackenzie, tell us about this forbidden fruit in your salad. I want to hear all about the driving one. Go.
It's one of those ones that, just came out of nowhere years ago. And I remember talking to my NOCD therapist, and I was in tears because we were in San Diego at the time, and my daughter's school was a mile down the road. And I was like, what kind of mother am I that I cannot drive my child
a terrible one? That's what kind.
I know. And also
awful. Yeah.
I could, I just wasn't. And I was that person who would turn 2-hour drives into truly one turned into like 6.5.
Really?
And
because of the going back and everything?
Yeah. And it's one of those things. This is one of the things that really just pisses me off about OCD, because it takes our ability to like trust our own mind and our vision and our thoughts. And, I'll be driving and I see this pothole. I'm pothole, hit it. And I'm like, person, damn it. Like, I just hit.
Damn it.
What's wrong with me? And it's one of the hardest ones because it feels so irresponsible to just keep driving. And sometimes it's white knuckle. And it's hard. And the really funny caveat to that is when an ambulance comes speeding the other way past me, and I'm like, shit, they're going to save the person that I hit that I didn't stop for.
Obviously, yes, that's what the police will be knocking on the door when you get home. How many times have you worried about that you were just waiting for the knock on the door?
Oh my gosh, so many times. And one of my favorite memories of therapy, because my husband was in a session with me and I had one drink and we were somewhere for like 4 hours, and then I drove home. So, very responsible, very fine. Right. But my OCD was like, oh, you horrible human, And so I was like, oh my gosh, Montana, were you paying attention? Like, I don't know. Did I hit someone? He's like, maybe. He's like, you might want to listen for the door. I'm not answering it when the cops get here. And my therapist was like, high five. Like, I love that response. But it is, we're a tough love, like silly family like that. But so many times I've looked at like street cameras in my past. I have looked up, was there a hit and run in the area? Then I felt like I needed to put in like driving OCD so that if the FBI or the police checked my, my Google search, they could say, oh, look, she has OCD.
Yes.
Because
that will throw the FBI right off the scent right there. Just
done. So just innocent right there.
Mm-hmm.
Yeah. Perfection. Yeah. But it's a hard one. And I think, it was really hard when my kids were in the car, because as they're getting older, like when they were little, it was like, oh, we don't notice. But my daughter would be like, Mom, wait, are we turning around? Are we turning around again? And I think that too, you have to deal with like self-reassurance in that too, because my brain will say, oh, my daughter's 7, she would know. And I have to, correct myself and be like, nope, just sitting with it. I don't know if she knows, and we're going to keep going. But it's a hard one. And I feel like because even, being in recovery, I have days where my OCD flares up. And I feel like when it does, that is like it's flavor of the week, usually. That's the fruit that it picks
The
out of.
fruit salad flavor of the week. Yes. Mm-hmm. Yeah.
But it's hard.
Well, SB, guess what you need to do? Get in the car. We need you driving, right? Work with a therapist to get you back out there. I am not your therapist. I cannot tell you what to do. But if you were my patient, I would tell you that's exactly what I would be working with you on, is getting you back out in the world and driving again.
Also, I drive everywhere now, all the time, which I say, like, Trader Joe's and Target are my happy places. So my husband probably wishes that I didn't fix that one. I'm just kidding. But
Yeah, right.
I can still order online.
Mm-hmm.
It's possible.
Yeah. That said, I spoke to a psychiatrist. He doesn't think my fear of COVID is OCD. He asked me what compulsions were done, and I told him avoidance. I explained that compulsions don't have to be mental or physical. Avoidance in and of itself can be a compulsion. Yeah. I couldn't believe he asked me that, and he tried to explain to him he doesn't think you have OCD. Can't wait to tell your therapist this one. Yes. Well, just proving our point. There's a lot of misinformation out there where people don't understand things. So. Mm-hmm.
Yeah, that's I've had OCD my entire life. I mean, that's really some of my earliest memories. But even when I was diagnosed, which was like the summer after 8th grade, and I'm 32 now, but the psychiatrist gave me medication, and guess where he put me back, Dr. McGrath? Talk therapy. So I continued to struggle for 20 plus more years because, I know that we can't know everything, but it does stink when the path isn't.
And then you found NOCD, right?
I did, and it saved my life and changed my life.
Fantastic. Caitlin says, can you talk about scrupulosity and ways to manage it? And are there counselors at NOCD that work with it? Yes, we train our therapists on ERP for scrupulosity. And we even have case consultation groups available to all of our therapists, and they can bring up cases if necessary. So sure, all those kinds of things. Can we talk about scrupulosity? Well, first of all, there's two forms. There's religious scrupulosity and there's moral scrupulosity. Moral scrupulosity would be a fear of doing something morally or ethically wrong, maybe offending other people in some way. I think a lot of OCD can fall under the moral scrupulous issue, because what if I give someone a cold? Am I a bad person? That could be a morally scrupulous thing. What if I hit someone with my car? Am I a bad person? That could make me a morally bad person for not going back and checking or something like that. So I think there's a lot of moral scrupulosity. And if you'd like, John Hirschfield and I did a 3-part series with the International OCD Foundation on it. Ethan Smith hosted it, and you can go on to the IOCDF website and you can check out our 3-part discussion on moral scrupulosity that we did. In terms of religious scrupulosity, it would be, well, maybe I've done something blasphemous. Maybe it's one of your fruits in your fruit salad, Mackenzie. I don't know.
It is.
Yeah. What is your fruit of scrupulosity?
Both, right? Because
Okay.
hitting people with a car and
Bad.
Yeah.
Yeah.
I always wanted to get a bumper sticker on the back of my car that said, like, if I hit you, I swear I didn't notice.
I like that. Would be a good one for OCD Awareness Week, maybe.
Yeah, but with religious OCD or scrupulosity, I went to Catholic school my entire life. We had nuns, and magic 8 balls were like super in at the time. So one of my biggest ones that I remember was Sister Sharon. I'll never forget her name. She told me that I was going to go to hell because I was shaking the magic 8 ball, and it was like taking the place of God. So one, scarred me as a child, but 2, my OCD took that and ran with it. So one of the coolest things I did, it was just like a funny moment. Their magic 8 balls have made a comeback, in case you didn't know. And they're all over Target. And I was walking through the other day and I shook the hell out of a magic 8 ball just for my exposure response.
Just for Sister Sharon. There we go. Yes. Yeah.
Yeah, but and the sign of the cross, I guess, I used to have to do that 3 times or else I felt like something bad was going to happen to someone, or I was a bad person. Like the heaven and hell thing, my OCD really latched onto that. Did you know it's the easiest way to get to heaven? You just do the sign of the cross 3 times. You're good to go.
Is that what OCD says? Oh,
Yeah,
okay. Well, there you go.
I'm good. Just kidding.
I don't know if you watched about 2 years ago, someone had asked about how you would sell your soul to the devil. They didn't know if they'd done it or not. They didn't want to do it, but they were afraid, what if they had done it? And so I invited all demons and devils to the end of the webinar and held an auction for my soul. None showed up, proving that I'm the soulless jerk that many people think I am outside of NOCD. Or maybe it just doesn't happen, right? Maybe it doesn't work that way. And that could be it also. Caitlin, we would never purposely have somebody do something blasphemous, right? We don't have to create new things. What we do is we take a look at what are the intrusive thoughts and images and urges that you have about religion, if it's a religious scrupulosity, and we have you learn how to just allow those to be there. You actually don't have to do something to make them go away. You can just let them be and let them fade on their own. It turns out the more you try to make them go away, the worse they get. And Mackenzie, I'm betting you've experienced this in your course of life, especially with all the talk therapy you had. Can you tell people what it was like trying to make thoughts go away for a long time?
Oh, it worked wonders. They just left.
Oh, well, we have a new therapy then, it seems. Okay.
No, I mean, yeah, there's no, you can't talk. You know the song Going on a Bear Hunt? Have you ever heard that song?
I ain't scared. I got
Yeah.
my gun by my side and my bullets too.
There you go.
Going to a river, can't go under it, can't go over it. You gotta swim through it.
Right.
Going on a okay, I know.
Can that not be the theme song for ERP though? Because you can't go around it, you can't go under it, you can't go over it. You have to go.
You got to go through it.
Yeah, and so trying to talk yourself. I love that. By the way, that was like we need that as a video.
That might be a meme later. Yeah.
But I think trying to talk yourself out of it, right? You continue to get stuck, and continue to ruminate, continue to look for reassurance. And so talking things through is good for a lot of things. OCD is not one of them, in my opinion. Like I'm not going to talk myself into feeling better. If I ask for reassurance, then 3 other things pop up in that conversation. And so I think realizing you can be a cheerleader for yourself. Other people can cheer you on, and you've got this. But we have to go through it. There's no talking ourselves around it.
Yeah.
So just remember the Bear Hunt song.
Going on a bit. No, I could also do Found a Peanut. Always a fun one also, if you care for that. Or There's a Hole in the Bucket, Dear Liza, Dear Liza. Always another. That one I also use a lot in OCD. Do you know that one?
No, but is it like, I need to hear it now.
All right. So everyone with OCD, I think you'll get this. There's a hole in the bucket, dear Liza. We'll fix it, dear Henry. It would be a song, but I'm just going to go through it quicker. With what shall I fix it, dear Liza? With a straw, dear Henry. But the straw is too thick. Well, cut it, dear Henry. With what should I cut it? With an axe, dear Henry. But the axe is too dull. Well, sharpen it, dear Henry. But the stone is too dry. Or what should I sharpen it with? With a stone, dear Henry. But the stone is too dry. Well, wet it, dear Henry. With what shall I wet it? With water, dear Henry. Well, how should I get it? With a bucket. But there's a hole in the bucket, dear Liza, dear Liza. There's a hole in the bucket, dear Liza.
It's really just the circle over and over. There's always going to be. I always say too that there's never been a time in my 32 years of having OCD where it was like, okay, you're done. I'll never bother you with that one again. Like, you figured it out. You won. Awesome. No, when I try to figure it out, I find 4 new things. It's just like if I turn around with driving, right? I turned around to save the one person that I thought I hit, but on the way there, I feel like I hit 3 more. So, it's constant.
Yeah. It's, I too have never in 25 years seen someone do enough research for OCD to go, ooh, thank you. We're good. Yeah, that was awesome. it's never happened. I don't see it happening. I don't know the name on here. I'll just say alien. How to handle when the exact fears from OCD come true. The money. I'm gonna bet that meant moment instead of money. The moment we let go of those compulsions and obsessions. How to handle it? Well, like everybody else who handles anything that happens in their life, you take it and you deal with it. Right? That's what you do. Now, I don't for a second believe that the obsessions or the compulsions were preventing something from happening. I love a coincidence and I know that they happen in life, and I have had people with OCD who want to look at coincidences and try to convince me that they're not coincidences. They actually mean something. Did you find that, Mackenzie, where you would read meaning into things that happened and why they happened when they did and all of that?
All the time. And
Mhm.
it's I think it's one of the pieces where it comes in that it's so illogical, but then it's so real at the same time, right? If doing the sign of the cross 3 times would prevent, keep me going to heaven, then everyone would do it, right? Or if
Yeah.
if that was in your realm. But it's, I think, one of those things too where good things happen in life and bad things happen in life. And if those happen, it's not because OCD was right, it's because it's life. Like there was this time where someone who had OCD had cancer, and that was her worst case scenario, which is one of my many worst case scenarios. And she's like, "Do you think my OCD just went away?" No, it found something that it decided was scarier than cancer, right? Because it's life.
Yeah. And for those of us who've lived with someone and who has cancer and who has died from cancer, you know, what if Susan died because I didn't do the sign of the cross 3 times? I wonder how much I should blame myself for that. That maybe, Mackenzie, if I'd only met you earlier and you told me about that, maybe I could have kept Susan alive if that was the case.
Yeah. And I watched a video from you not too long ago. I shared it in a support group about, you know, OCD would come in and say, for relationship OCD, I think you were talking about, like, oh, well, should I have just never gotten married if
Yeah.
the end result was, and it's living life and enjoying life and being present and knowing that good things and bad things are going to happen.
Right.
Um, but
OCD takes you out of life, though. You don't even really truly get to live. You get to live OCD's life, but you don't live your life. You're living OCD's life, and it's why I say all the time, you're going to spend the rest of your life next to your tombstone wondering when you're going to be under it, or you're going to spend the rest of your life having a great time, and then on the day of your death arrive at your tombstone and say, whew, well, that was fun, and then be under it, because we're all going to be under it one day. What we do between now and then is our choice, and there are things along the way they're going to try to pull us down paths and rabbit holes and all sorts of things, and we ultimately can decide, well, okay, I'm going to go there, or you know what, uh I hear you, I see you, I'm just going to choose not to do that and go there.
well, that was what really pulled me out of my mess. Is my core fear was death, and I had this realization of I was so afraid of dying that I wasn't living. Like I had become what I feared most. Like the only thing scarier than exposure response was the life I was living. And
Yeah.
I think it's like this painful moment where you mourn what OCD took from you. Cause I always say it's kind of like a hurricane that hits in the night, right? Once everything starts to clear and the dust settles, you realize how much chaos it's caused and how much damage it's done and how much time it's taken. And I think that's what really drives me in that value direction of, like, I can't change the past, but I have control over my future. And living is something I value, being present and not wasting any more time.
Hopefully your kids value that with their mother as well. Mhm.
Yes.
Although sometimes they might be like, can't you go away for a while and just leave us alone, right?
Yeah.
Yeah, yeah. Hmm. but
Yes.
but you probably get to be the mom you never thought you could be when the throes of OCD were going on.
Oh, I do. And that was one of the most painful pieces. I think I realized that my OCD was sucking the life out of everyone, not just myself. And I know that I didn't choose to have this disorder. I know that that's not in my control, but what was in my control was pushing myself to do those hard things, because I wasn't functioning as a human being, let alone a mother or a spouse or a friend or a daughter. And I said it's really bittersweet, but I feel like at 32, I finally know who I am, and I am experiencing peace, and I'm enjoying all these moments, and it's things that I never thought were possible. And so, when I talk to people in group and here, I've been at that lowest of low. My life was pure chaos. And I truly think I lived in chaos for 28 years. I just kind of got comfortable in it. But exposure response therapy, nobody sat me down and said, Mackenzie, you're going to learn self-confidence. You're going to learn self-awareness. You're going to learn to lean into your values. Like, that wasn't, I knew I was going to face my fears. I knew I was going to do all these things, but exposure response therapy, which I did through NOCD, taught me to be confident. It taught me to, have that self-awareness, to know when my OCD is present. It really completely changed my life.
Awesome. Mariel says, when you don't have time to do compulsions, should you ignore the compulsions or do them? The overwhelming answer that I give on all times is don't do compulsions. Unless you want OCD to get worse, then do all of the compulsions if that's your goal. But if your goal is to not feel worse, don't do compulsions, because even if it doesn't feel great in the moment, in the long run, it will be better for you. And it says also, if you manage to not do a compulsion, what if your brain keeps remembering that you didn't do a compulsion? I bet, Mackenzie, that happened to you when you started therapy, right?
Yes. And it's one of those things. It's such a simple, like, help me say this in a way that doesn't, the concept is very simple. Like, the idea of do not give in to the compulsion, sit with it. But it is the hardest thing in the entire world. And it's that realization too, when you give in to the compulsions, you know where you're going. Like, we get to the end of it, and we get stuck in that spiral, and it's like, oh wow, here I am again. Like, I thought I would be somewhere else, right? And it's, learning just that simplicity of, when that anxiety rises, and if we don't, it's so hard. The hardest thing to do is the opposite of what OCD is telling you to do. But the only way we feel better is to not, and to sit with it. And if I do it, I know where I'm going next. I'm going to get stuck. But it's hard. It's hard. Also, I think it's really funny when I was like, OCD would tell me this one thing was going to kill me if I didn't do this compulsion. So it would be like weeks of this, this one thing was going to kill me. It was the scariest thing ever. And then it would jump to something else, and I'd be like, oh no, shit, give me that one back. Like, this one is scarier. I don't want this one. I want that other one back. Like, it's always going to be something else.
Yeah. How many times have you died from OCD, Mackenzie? Just curious.
I always say, if I had $1 for everything that was going to kill me, I would give Taylor Swift a run for her money, because rabies, hepatitis, AIDS, asbestos, that was a huge one. All the things. My husband said this funny thing to me one time, because my contamination OCD, the grocery store used to be really hard for me, and I would like try to see which cashier seemed the least contaminated, which
no bandages on their hands.
Blue band-aids, they are such a pain in my OCDs, but I would constantly, search and scan for danger. And there were so many times where I'd get to the end of the line. They'd be like, okay, you're next. And then I would notice they had a Band-Aid, and I was like, oh God, I forgot something. And they'd say, oh, you can just leave your cart here. And I'm like, no, I'll be right back.
No, I'll be fine. Yeah.
And we were walking out one day, and my husband's like, do you know, like, these apples we have in our cart, like, somebody could have scratched their butt and touched an apple, and you have no idea, right? Yeah. Like, it's just like OCD thinks that you can create this certainty and safety, and there's all these other things that.
Yeah. And then there's the fart apple. Right. Exactly. Yeah. And Mm-hmm. Well, and that is an interesting piece of it, right? If I don't see it, I'll just pretend it's fine. But if I see it, I have to react to it as if it's the worst case scenario.
Mm-hmm. Mm-hmm.
Yeah.
Yep.
Last question for tonight. Max says, "What's your general thoughts on agoraphobia?" That it's very limiting to people's lives. That's my general thought. You talk about a fear of or an inability to escape situations like flying. How are these thoughts different from OCD? Typically, if you're not being triggered by a flight, and if you decide I'm never going to fly again, that thought is never going to bother you again, right? Or if it does pop up, you'll be able to say, yeah, well, I'm not flying anymore, and it'll go away. OCD is not like that, though, right? OCD is with you all of the time and constantly putting thoughts back into your head. And even if Mackenzie had done a ritual to the satisfaction of her OCD, 5 minutes later, then the obsession would be, well, but what if you were wrong? What if you didn't actually do it right? And then you'd have to go back and you'd have to do it again. So, Max, that's one of the big differences that we'll see there is just in the way that some of these things appear and the insidious nature of it. And OCD is probably one of the most insidious types of things that we see out there.
Yeah, I think it goes to that. I always think about when HIV was my OCD's favorite thing to latch onto. I was like, I could go. I even took like a home HIV test, like even like, and I would do all, and it was like, oh well, you gave into the compulsion, so now you probably didn't have it, but now that you went to the aisle where someone with it went and took the test, like you infected your, like there's always going to be something more. It just is constantly shifting.
Mm-hmm. Mackenzie, we're getting some questions. Are you a therapist?
No, no,
No,
no, no.
just plays one on TV. Yeah, but you do run some of the support groups. Can you tell everyone a little bit about the support groups you do here at NOCD for NOCD members?
Yes, so you have to be in active therapy for NOCD, and I run supporting others. So that's like family members and loved ones that have someone in their life who has OCD, depression and OCD, navigating uncertainty. Yay, my favorite thing to do. What else? I have another one. Oh, managing OCD. But there's lots of really, really good groups. And there are some therapists that host groups as well.
Yep, exactly. And give everyone some parting advice on a person who has had OCD for over 2 decades and has seen what not great therapy can do and also experienced what great therapy can do, and leave us a little message of hope for those out there.
Yeah, I think that something that I have an internal struggle with is I feel like sometimes when I talk about things, it can seem like I'm coming from a place where like, oh, it must be easy to say that because, yours isn't, as loud, or you're not in this place where I'm at. And I, I, I don't mean to harp on it, but I promise that I've been there. And, I dropped out of college twice. You know, high school was a nightmare. All my relationships struggled. I lost 20 pounds I didn't have to lose. There are so many times in my life where, again, I was so comfortable in the chaos until I couldn't be anymore because I had reached lower than low. And I say all that to say, I didn't think I could ever see myself where I am now. And I am so thankful for NOCD because there is something so awesome about, I think one of the coolest things is being able to do exposure response on virtually because they're actually there to sit with you and go through these things with you. And, I truly, truly got my life back. And, I feel like there's so many people who feel like there's not hope but there's so much hope, and recovery is so stinking possible. And ERP therapy works. It does. And I think I saw the most progress when I pushed myself over that threshold and committed to doing the hard things. But yeah.
Awesome. For those of you who hear that, I hope you recognize that Mackenzie too had to deal with her fears of coming into treatment, and what if this wasn't OCD, or what if they think I'm psychotic, or just every what if question out there in the world that you had to deal with as you were coming through. But now you get to help other people who have this, and thank you for that and the gift that you give to others for that, Mackenzie. We really appreciate it.
Thank you. And thank you for everything you do.
Of course. And for those of you looking for help, come to NOCD.com. We work with people who have OCD and related conditions. We would love to help you out. You can get started with a member with our care team. They'll do a free 15-minute call with you to get you started, and then we'll get you set up with a licensed expert therapist in your area. So NOCD.com. We do work with hoarding, OCD, BFRBs, tics, and one of my favorite things, NOCD 411 sessions. So if you're looking for help, and you're not quite ready yet for therapy, but you just want to ask some questions and things, well, we would be more than happy to have a session with you. Not a therapy session, just an info session, and get you some info. Until next week, everyone, be well, be nice to yourselves, and don't listen to your OCD, because it does not have your best interest at heart. We'll talk to you all soon.